Hello, everyone. My name is Shad Morton, and I'm presenting today on the long-term effects of COVID-19 with Logan Gray Donis. Our data set comes from TriNetX, which is a supplier of real-world clinical data, and we have massive files that we needed to clean up. So this is our data flow. We have started with 1.6 million patients. We had to shorten it down to 3,000 for timing and computer restraints. And that's where we ended up with 14,000 and plus diagnoses and 3,000 patients. What we wanted to look at was patients pre and post, that's 14 days after a COVID diagnosis. And after we made our master sheet and we were able to simply plot a pre-COVID diagnosis along with a post-diagnosis COVID. And we can see that there was a lot of movement for things such as anxiety disorder, acute respiratory failure, and shortness of breath. And here is just a couple of word clouds detailing that. So I'll pass it on to you, Logan.
Cool. So for the clustering of this, we just kind of reorganized the data a little bit and then created a Boolean array of all the diagnoses for patients. So 0 if they don't have that diagnosis and a 1 if they do. And from that, we use an agglomerative clustering model to create clusters using unsupervised learning. So you can see from this dendrogram here that we have a good separation at about 4 clusters. So that's what we went with. So from those 4 clusters, we looked at the top codes that patients had in each cluster. And we kind of were able to see that the clusters had different numbers of and types of diagnoses. So in this first group here, we have some diagnoses that are associated with long COVID. So once we had those clusters, we went and looked at the pre-COVID data set and used a little supervised learning to create a model that could predict whether or not a patient would develop long COVID symptoms. And you can see that here we use a decision tree to do that. And we created this model. It has the best accuracy at around K equals 10. So we're able to predict with about 80% certainty or accuracy whether or not a patient will develop COVID, long-term COVID effects. And that was kind of the goal of our project. So